Okay, so unfortunately the two co-directors couldn't be here today, so you've got me, the Dementia HIT coordinator, instead. So we started back in October 2012, and our aim is to achieve the best quality of life for people and families affected by dementia. Is this going to work? Hooray! So the thing about dementia is it does impact not just on people living with dementia, but also families, carers, friends, society, health services. It's massive, the impact. And a recent report for the Department of Health estimated 21 million people in the country know a close friend or family member with dementia. So that's a whopping 42% of the population. So our HIT's got a massive task in front of it. So Dementia Services are provided by loads of organisations, and since the HIT was formed, we've tried to connect with as many of these as possible. So we've got the partner organisations, which are the partner organisations Bristol Health Partners. But because of local service changes in Bristol, we've also got things like Alzheimer's Society and Devon Partnership, who are the new Bristol Dementia Partnership, and also Bristol Community Health, who provide services for people with dementia. But there's a whole load of other charitable and voluntary organisations that also provide services for people with dementia. And these are all along the bottom. So we've tried to network and connect with these as much as possible so that we know who's providing what, so that when people come to us, we can be a bit knowledgeable. A big part of our HIT is research. And on there's a big list of the types of research that goes on that's related to dementia. And in January, we put on a research showcase, and we had people presenting short TED-Med style 8-minute talks about their research, and a lot of these areas were covered. And the feedback from the event was, wow, there's such a lot of dementia research going on in Bristol, and it's not just about transforming hospital services, it's also about people living at home and living well at home with dementia and the support they need for that. In our first year, we also collected some data about the attitudes towards dementia across Bristol and South Gloucestershire, and we've just had our first publication on that data in International Psychogeriatrics. So what we did is we had over 2,000 people respond, but we took out the responses from the people that had never worked with people with dementia, so basically the population. So it was about 790. And actually what we found is people in this area have got really positive attitudes towards dementia. So we don't know at the moment whether that's the HIT doing great work or whether that's just generally people have got positive attitudes. And comparing those to kind of medical professionals, the attitudes weren't much different. So that's a really good finding, but it also means when we repeat this, how do we make them any better when they're already really good? The other good thing about the research work streams, so we've got some great collaborations, so between NHS trusts, universities and charities. So some of these are formed because of the HIT, and some of these have strengthened with existing ones, so there's better collaborations going on for funding. But it's not all good in the HIT. It never is it? There's been quite a lot of change in directors with change in roles, change in services, and it's been quite hard to keep consistency for some of our work streams. So one of the work streams, education, has basically ground to a halt over the past year. So it's still there, it's still on our website, and we still want to do something with it, but we just haven't for a while. As Julie mentioned earlier, there's also a problem with lack of protected time for people. So they really want to get involved and they want to be part of it, but actually they haven't got the time to do that. And that links into funding and lack of, and also recruiting new people, because people sort of say, yes, we want to be involved, but actually we can't, we haven't got the capacity. So there's lots we want to do, but we can't. And there's also things with the new government initiatives that we do need to link in. So with the transformation plan, we know there's a big area about prevention, which has never been part of our strategy, but we know we need to link that in. We're also really grateful for Zoe and the team for giving us the website, and we've got all this amazing resource, but actually it's really time consuming to update that. And every time we look at it, we think, oh no, that's a bit out of date, we need to do something about it. So we know that dementia is like a massive scale across the country, but it's also a big thing for us, but we're still really passionate about doing it. So with that passion, we're really passionate in involving people with dementia, and PPI is one of the work streams which has done really well. So we've now got a volunteer panel of people that some are people living with dementia and some people are supporting people with dementia. and they've been inputting into various activities of the HIT and also their wider organisations. We've got PPI guidelines, we've also got a PPI resource list and a request form for help. And we had some help from the AWP BEST team to do a literature review on the best ways to involve people with dementia, and that's now available on the website for a resource for others. We've also got Dementia Friendly Communities work going across Bristol and South Gloucestershire, and a lot of that's aligned to the Dementia Action Alliances. VOSCA have got a new project commissioned by Bristol City Council, Active Together for Dementia, which is going to be fab. Because a lot of the time people with dementia, it's not that they don't want to do activities they might have done in the past, for example going out walking or cycling, it's just that they can't do it on their own anymore, because if they go out they might get lost because they're not sure how to get back again. So this Active Together for Dementia is pairing up people living with dementia with a volunteer. So actually they go out cycling together, so it means the person with dementia can go out, have the exercise, but they're going to get home again, which is great. There's also growing support, which is about therapeutic gardening. So they've got gardens within the city, community gardens, but they also do work within care homes. So they go in and do therapeutic gardening within the care home. So it means that everybody's included in these activities. So there's been loads of change in the HIT. So that's a picture of the HIT in 2013 and a picture of the HIT team now. And as you can see, there's not that many people that are on the same team. And since the 2016 picture was taken in January, a few of those people don't exist anymore now. So it's constant change, but we're still really committed to doing things. There you go.